Adjunctive azithromycin prophylaxis for cesarean delivery. Cesarean delivery is the most common major surgical procedure for and is associated with a rate of surgical site infection, including endometriosis and wound infection, that is 5 to 10 times the rate for vaginal delivery. Patients were randomly assigned to receive either azithromycin at the dose of 5,000 milligrams in 2,050 milliliters of saline, or an identical apparent saline placebo. Clinical and research staff members other than the investigational pharmacists were unaware of treatment assigned.
Hi, I'm Dr. Shifali Tyagi. I'm the obstetrician and gynecologist. If you are running a fever in pregnancy, there could be different scenarios. If it is a normal viral fever, which generally affects most of us, then the fever itself does not cause harm to the pregnancy because the body has immunity against the viruses, and generally the body fights off. So in that case, the baby will not be actually, harmed by that fever instantly, specifically if it's for a short duration. But in some cases, there can be number of viruses which are very, very harmful to the pregnancy. So they can cause a lot of damage to the baby if they kind of have infection in your body and then they pass through the baby through placenta. In that case, the baby can have congenital defects, or baby can develop symptoms of some deficiencies later, and sometimes even loss of pregnancy can happen. So actually it's very difficult to say which fever is safe and which fever is not safe. From your point of view, 2 to 3 days you can see at home with maybe 101, 102 type of fever, managing with Dolo 650 or a paracetamol. But in case it is not settling down, it is always safer to go and get checked. In case some blood tests are required, ultrasound is required, the doctor can advise admission. Run those tests and make sure that you and the baby are fine.
Pro and cons. Consumption of azithromycin during pregnancy or lactation is subject to the control of physical studies have shown that azithromycin grows the placenta, but has not revealed evidence of damage to the fetus. However, the sulfate of its use in pregnancy and lactation has not been established, so that in pregnant women and infants it should only be used when there is no other alternative available.
In terms of taking antibiotics when pregnant, 9 months is a very long time, and women are probably going to get some sort of infection during pregnancy. Thankfully, most of these infections will probably be viral and self-limiting, but there may be conditions in which pregnant women need to take antibiotics. These could be, for example, a bladder infection or a kidney infection. In these circumstances, most antibiotics are safe during pregnancy, but there's definitely ones that you need to stay away from, such as tetracyclines or gentamicin. If you're concerned at all about antibiotics in pregnancy, it's worth having a conversation with your doctor, for example, phoning the Dr. Morton's advice line or emailing Dr. Morton's, just so you can get some medical advice about antibiotics in pregnancy.
Usually applied in Ecuador. In Ecuador, early study proposed that an azithromycin-based extended spectrum prophylaxis in combination with the standard cephalosporin prophylaxis might reduce the risk of infection following cesarean delivery more than standard prophylaxis. Conclusion. It's very important to take into account the recommendations when applying azithromycin acid in antibiotic that can have some type of adverse reaction in case of not having a correct application, and it is necessary to be administered only under medical supervision.
Hi, I'm Jordan Klevenoff. I'm an OBGYN resident at Christiana Hospital, and welcome to this week's episode of Pocket Pearls. Welcome to this week's episode of Pocket Pearls. I'm Dr. Jordan Klevenoff. I'm here with my colleagues, Dr. Chelsea Kibido and Dr. Tony Paserno, and we're going to talk about giving azithromycin at the time of C-section. C-section is associated with a rate of surgical site infection that's about 5 to 10 times higher than that of vaginal delivery. And post-operative surgical site infections
given either pre-incision or as soon as possible after incision.
Are there any important limitations to the study?
There are. So this study excluded women that were having either scheduled C-sections or had a diagnosis of chorio. So the findings aren't applicable to these groups of women that we commonly see.